Are we ready for a measles outbreak? Well, that has been the question health officials have been asking for weeks now. And now concern is growing with the news of a potential vaccine shortage. Here's our friend Dr. Isaac Bogoch, who joins us now for more on this. Dr. Bogoch, good morning to you. We got a pair of companies say that they are running low on doses as demand for the measles vaccine grows. Just how concerning right now is the vaccine supply situation?
Yeah, certainly that's something we need to keep an eye on. That's very important. On the one hand, you never want to hear about shortages, especially with something like a measles vaccine, and especially when we hear that there's a growing burden of measles in the world and more, expected cases in Canada. On the other hand, we hear about increasing demand, and you never want to frame this as a good thing, but at least some people are getting the message that they need to be up to date on measles vaccines, and people are going out and getting a measles vaccine if needed. So there is a sliver of positivity to that, but of course we cannot have vaccine shortages, especially when we know we're going to see more cases of measles imported into the country and more possibility for local transmission within the country.
Because how may that potentially, the shortage impact the spread of the disease? Because for weeks, health officials have been strongly advising Canadians to be fully vaccinated. So what's the worst case scenario?
Yeah, I mean, obviously, we don't want to have shortages, and we want to make sure that everyone is up to date on their vaccines. That's just stating the obvious. We know that measles is extremely contagious. And of course, if we have unvaccinated or under-vaccinated communities, there's always the potential for this to spread and for us to have local outbreaks. The real question, I don't really have a good answer for this, unfortunately, because the real question is, what is the actual demand of Canadians, and what is the true need of Canadians? Obviously, we have kids being born, and we're going to all the time, and we're going to have this constant need for vaccination of children who are turning one. But what's the need of the population, for example, that have had one dose or no doses that need vaccinations that are that aren't children? And I think we need to do a bit of a deeper dive to see what is the need of the country, what is the degree of the shortage, how long are we expected to have this shortage, to see if it will actually have a meaningful impact.
Also, Dr. Bogoch, I just want to ask you about this story that has caught the attention of health officials. A fully vaccinated teacher in Ontario recently reporting that they contracted the measles. As I mentioned, this has got the attention of health officials. Just how rare is this?
Yeah, great point. So a couple of things with this. For starters, in medicine, just like in life, nothing is 100 or 0%. So the measles vaccine is fantastic, safe, effective, widely available, even now, free. But it's not perfect. And there are a small percentage of people that are what we call non-responders, or people that just won't have an immunologic response to the vaccine. That might be anywhere from about 1 to maybe as high as 3 or 4% of people. But it certainly is something. And, the reason that that's important is that certainly some people who have had 2 doses of the vaccine, very small percentage, might not respond to the vaccine and still might be susceptible to measles. But if everybody is immune to the measles in the country, we don't see propagation of infection within the country, and that protects people who are unvaccinated, for example, the children who are under the age of 1 who haven't had a vaccine yet, and people who haven't responded to the vaccine, which is a small percentage of individuals like this person, in addition to people who might have compromised immune systems, who might have been vaccinated but have waning immunity because of their immunocompromised state. So everyone being vaccinated and immune protects those who cannot be vaccinated.
So having said all that, where do you think we are at right now with the current measles situation in Canada?
Okay, we've got to be careful here because there's a big global surge of measles, which means we're going to see more imported cases into Canada. That's not going to go away anytime soon. And we need to be very vigilant here to make sure that everyone is up to date on their vaccine. There are still problems in Canada in the sense that there are people who are choosing not to be vaccinated or who have missed routine doses of vaccinations throughout, for example, the public health disruptions of the pandemic. So we certainly have susceptible populations. We've got to keep our vaccination rates high, certainly above 90%, preferably above 95% to really prevent these local chains of transmission within Canada. And we've had some of these recently. There was, a case in Ontario and a case in Quebec of people who acquired this infection with no travel, with no known exposures to measles, which means there's people walking around Canada who have this infection who can be infecting others. So we have to remain vigilant, double down on our efforts to get the community vaccinated and up to date on vaccines, We got to take this seriously. You can't let your foot off the gas pedal here, because this is a very transmissible infection. It has a knack for finding unvaccinated and undervaccinated people in populations. And we're going to see more imported cases because there's just so much of this around the world, unfortunately. So we have to really double down on our efforts in Canada to prevent this from taking hold in the country.
Appreciate the update. Dr. Bogoch, always good to see you. Thanks for this and have a good weekend.
My pleasure. You too.